the Ghanaian people talking. And that's why we're also taking a close look at this report on Village Square Africa. My name is Kemini Amano, and you're welcome to the Square. Joining us now is Ibrahim Al-Hassan. He's a senior journalist from Ghana. We will also be joined by anti-corruption campaigner Vitus Azeem. But right now we have Ibrahim, so let's talk to Ibrahim. Ibrahim, good afternoon and many thanks for joining us here on the Square. The Ghanaian people...
Good afternoon, Kamini.
Indeed. The Ghanaian people have been asking for this report, and now it's here. What are some of the disclosures that have got people talking? Ibrahim, can you hear me? Well, I'm not sure.
Parliament sometimes back filed the motion for
Ibrahim, we lost you for a bit, so if you could just back up slightly for us.
Well, Kamini, you're right. This report has been much awaited, I must say, and that from the very beginning of our exit from the pandemic, so to speak, or when the figures started dropping, I'm talking about the cases, this demand has been on the table because other countries have done same relative to auditing of its COVID expenditure. And now here in Ghana, this particular crusade was started by the minority in parliament. They actually went to the extent of filing a motion for the constitution of a bipartisan probe into how government spent the over 21 billion Ghana cedis that it raised for fighting the COVID-19 pandemic. That particular move was truncated when our first Deputy Speaker, Joseph Osei-Wusu, shut it down. His argument was that there is a designated body that is tasked with the responsibility of probing the accounts of government, and that's the auditor-general. So Parliament cannot arrogate to itself the powers of auditing government accounts. So that was the explanation given by the first Deputy Speaker, Joseph Osei-Wusu, when he made that decision to shoot down the motion. Subsequently, Ken Ofori-Atta, the Finance Minister, informed Parliament that government had instructed the Auditor-General to undertake a special audit into the COVID-19 expenditure. From what I know, there were external forces as well demanding that this happen. So you talked about the IMF, where the government got some funds from. We talk about the World Bank as well, and then the Africa Development Bank. All these external institutions, as well as donor agencies, were equally piling up pressure on Ghana to undertake this audit. 3 days ago, the Auditor General made public its findings, as you have mentioned. So it's been a long time coming. Some of us are not in the least surprised, Kemini, because day in, day out, when we sit on air, these are the demands we've been putting on the doorsteps of the government, because we are aware as to how some of those funds were spent.
I see.
We are aware that, for instance, a chunk of those funds were devoted to helping small-scale businesses to recover from the ravages of the pandemic. Some individuals took advantage, applied, and got some loans. As we speak, if you delve deeper into the report, you realize that NBSSI was given some amount of money, 600 million Ghana cedis. Over 400 million was disbursed by way of loans to businesses and individuals. As we speak, as at the time the audit work was done, just about 50 million of that amount has been recovered. And that should tell you that indeed we'll definitely have a problem there. And these are some of the things that got many people asking
and I want us to
such a probe.
Indeed, I want us to look at some of the infractions. You've talked about the funds that were given to small businesses and could not have been paid back, although they had 2 years to do so. What other infractions took place that, for instance, shocked the Ghanaian people?
Well, so the Health Ministry decided to procure 26 ambulances, made full payment. And of course, as at September last year, when the ambulances were supposed to arrive, the ambulances have not arrived, in spite of the fact that full payment has been made. Now, the auditors are warning that if care is not taken, the supplier could then apply to vary the cost of these ambulances upwards. And so the health ministry must move heaven and earth to ensure that as at the last deadline that has been given to the supplier, these ambulances are brought into the country. Mind you, these are ambulances that were purchased to assist the country deal with the COVID-19 pandemic. That's not the end. Even vaccines, we have in excess of $81 million, $81 million that we paid for vaccines, and as we speak, the vaccines have not arrived. The recommendation of the auditors is that government should make effort to ensure that the vaccines, as we speak, might not be required by government because we have enough vaccines as we speak. So there should be renegotiation to ensure that the vaccines that we paid for that were not supplied to the tune of over $80 million, there's some renegotiation for these funds to be brought back to be returned to government chest. Again, you talk about...
And Ibrahim, before you move on to, the next infraction, I want us to stay with these two things that you have mentioned, starting with the vaccines. What explanation has the health ministry been given as to why they paid in advance for vaccines, and when they knew that we didn't need the vaccines anymore, they didn't work at getting refunds from UNICEF?
Well, so indeed, the government officials, I'm talking about Chief Director for the Health Ministry, who provided answers to the auditors, explains that, as usual, we were not in normal times. We had an emergency to deal with. We had a pandemic on our hands. And so that informs the reason for ordering for these vaccines and paying for them ahead of their supply. Now, some vaccines were supplied, of course, and the auditors made those deductions. But what is outstanding is in excess of $81 million. They've actually triggered a process that involves the World Bank to engage UNICEF and its partners to ensure that renegotiations are done and these funds are returned. But of course, the auditors are questioning why it's taking government this long to ensure this happens, especially given the fact that now we have enough vaccines stored. We don't even have people ready.
Well, I think we lost Ibrahim there for a bit, but he's been telling us about some infractions that have been identified in an Auditor General's report regarding the use of COVID-19 funds by government officials in Ghana. We hope to raise him back over the telephone so that he can tell us more, over the Zoom link, so he can tell us more about this. But so far, Ibrahim, are you back?
Yes, I am.
Right, make your point there.
Yes, so I was saying that government has initiated a process, and that's the explanation given to the auditors, that the World Bank has equally been involved to assist in renegotiating with UNICEF and its partners to ensure that if for nothing at all, if not the entire $81 million, at least a portion or a fraction of it is returned to government chest. But of course, the auditors are questioning why it's taking government this long to trigger this process of ensuring that these funds are returned or the vaccines were supplied on time. Government was equally explaining that they had a problem with storage facilities. Then arises the question of why order for that much if you don't have enough storage facilities in the first place. But of course, these are questions that government appointees will have to answer when this report eventually gets to the Public Accounts Committee in Parliament as dictated by Ghanaian laws.
I see. And then we also know that over 1 million of the vaccines expired. What did the report say about that?
Well, so the report is questioning why, first of all, the vaccines were allowed to expire. Again, it comes back to the inadequate storage facility and vaccine hesitancy on the part of Ghanaians. And that is a very big problem, where many Ghanaians were not ready to receive these shots. Because of the myths surrounding these vaccines, the uncertainty, the lack of enough information about even side effects of these vaccines. It became a challenge. Try as much as the health officials here through the Ghana Health Service did, and government in general, many Ghanaians are still uncomfortable subjecting themselves to receive these shots. But of course, the bottom line is that government procured vaccines without knowing exactly where to store them. And this problem was compounded by the basically hesitancy on the part of Ghanaians to receive this COVID-19 shots.
I see. Let's talk about the other infractions that were identified. You've told us about the 26 ambulances. You've also told us about the vaccines and, you know, the various infractions that took place with procurement of the vaccines and even storage of it. What other infractions were identified in this report?
Well, Kamini, so when you come to Ghana and you want to engage government, and government is to make payments, there's a system that has been developed for all government payments. It's called GIFMIT. And GIFMIT is a centralized government payment system. It was instituted by former Finance Minister Seth Terkper when he was Deputy Finance Minister all the way to Finance Minister. It is to ensure accountability relative to the use of government funds. What is shocking from the auditor-general's report is that out of the over 21 billion Ghana cedis received in the name of COVID-19, only 3.5% of that money was spent using the GIFMIT system, which then makes it difficult for tracking and accountability requirements, basically. That is shocking to many people, because if you delve deeper into the report, you realize that even the hot meals that were cooked and served to a number of Ghanaians, so to speak, who were described as poor during the lockdown in the Greater Accra region and the Greater Kumasi region, spearheaded by the Ministry for Gender, Children and Social Protection, and then also the National Disaster Management Organization, NADMO. Tracking of the caterers who have been paid became an issue. And the reason is this. Instead of issuing payment vouchers, the ministry decided to do what you can best describe as over-the-counter payments. And to the auditors, that posed a big challenge for them, because even though payments had been made, it was difficult to track down the caterers and find out whether indeed the food that they were paid for, the hot meals, had been cooked and supplied to individuals during the lockdown. That is one. Two, out of the, like as you mentioned, the over 21 billion, over 11 billion was used for direct COVID expenditure. Another 10 billion was used for budgetary support. This particular audit did not capture that expenditure. And Camille, you know why? Because, as you said, this is a special audit specifically covering expenditure on COVID-19 related activities. So the over 10 billion that was used for budgetary support definitely could not be captured under this audit. But of course, all is not lost in that regard, because the Auditor General, as the law permits it to do, conducts annual audit of government expenditure. This is a special audit that covers only COVID-19. The rest of the Auditor General's report that will come, will be published, will come out or will be published, will cover the other over 10 billion Ghana cedis
that went into budgetary support
and some other things, basically.
Yeah, but I just want us to look at a few other things that you mentioned. And I may have lost my train of thoughts right now, but I do know that one of the things that was really important to the Ghanaian people was the utility subsidization, which afterwards government said wasn't free. But in this report, it would seem that some monies were claimed for that. Talk to us about the dynamics here.
Well, so government in the height of the pandemic decided to offer relief to Ghanaians, the general public. So, for instance, households were asked not to pay electricity bill. Government had absorbed those bills. Again, households were asked not to pay water bills. The explanation was that because of the lockdown, many businesses have suffered. By extension, families and individuals had equally suffered. Their income levels had been affected. And so it will be insensitive on the part of government to compound that challenge with demands for payment of electricity bills and water bills. Now, after which government instituted a levy that Ghanaians are paying, but the report specifically talks about the fact that it is unable, the auditors are unable to track those payments that government is reported to have made to these utility companies. And once again, it boils down to lack of access to receipts on the part of these auditors when they made these demands for answers relative to these payments. Again, the utility service providers were supposed to tell government how much of their bills government had to pay. Again, the auditors argue that the utility service providers were unable to provide evidence as to how much that Ghanaians had consumed, reason why government had to pay for those amounts of money. And mind you,
And also on the utility bit, we also realized, based on what the Auditor General had reported, that it would seem that they were taking advantage of the period to take monies from the government. And the Auditor General has recommended that those monies be retrieved. What were they asking for?
Well, so in essence, payments had been made to these utility companies without justification whatsoever. So for instance, if the amount due them was 1,000 Ghana cedis, because of the times we were in, and these utility service providers having sensed that there was an advantage to be taken of the situation, inflated these amount of money. Government then paid these monies. The recommendation is that these utility service providers are made to return those extra payments to government chest. Of course, we are yet to see as to whether that recommendation has been implemented or not. But of course, as I said, this document, this Auditor General's report, just like every other Auditor General's report, will end up in Parliament. It will be referred to the Public Accounts Committee. These managers of utility service providers will be made to appear before the Public Accounts Committee and answer questions as to why just these infractions in the first place, and as to whether they have been able to pay heed to the recommendations of the auditors. And I'm sure we'll return and talk about how effective or ineffective PAC or Public Accounts Committee has been in this regard over the years. But of course, specifically to utility service providers, this is exactly what the infractions are. These are the recommendations. We are here to find out as to whether these recommendations have been implemented.
Absolutely. We'll go into that in a moment. But I just want us to look at a few of the infractions that had been, the source of conversation in Ghana for a while. One of that being health insurance for frontline workers. Government made a bold step to cover, the health of those who were on the front line, working to keep all of us safe in Ghana. However, the Auditor General says there's a problem with the way the insurance coverage was done. What is the concern of the Auditor General?
Well, so over 10 million Ghana cedis has been paid to these insurance companies led by Enterprise Insurance Company, which got about 30% of the entire insurance package for frontline health workers, followed by State Insurance Company, SIC, among others in that regard. So, Kamini, when you sign up...
Well, I think we lost Ibrahim again. Hopefully, that Zoom connection will be restored.
This document. Yes, Kamini, can you hear me?
I can hear you now. Go ahead.
Yes, Kamini, can you hear me?
I can hear you. Go ahead.
Yes, so when you sign up for any insurance, specifically life insurance policy, you're supposed to have your name captured in a document. You're supposed to even also append your signature to that particular policy document. And that will be your license to be able to claim any anything that is due you when the insurance policy matures, right? In this case, government decided to sign an agreement with these insurance companies. So there's a framework that says over, say, 10,000 health workers, frontline health workers, are covered by this particular insurance policy. But government did not follow through to indicate by name each and every member of their frontline health workers who, of course, are covered by this particular policy. And that, according to the Auditor General, is a problem.